Welcome to another Counselor Soapbox video, learning about alcohol, part 31, working with special populations. In this video, we will talk about working with senior citizens and the elderly. The elderly population is growing both in number and in percentages. There are inherent stresses of aging. Biological stresses are important to consider. 50% of the elderly have physical disabilities. They may suffer from malnutrition. There are physical ailments, chronic conditions such as diabetes or thyroid conditions, and many may experience chronic pain. For some, aging also means a loss of cognitive function. Other stresses of aging include social stresses, the loss of family and friends and social connections, the loss of roles. Most elderly no longer have jobs. There's also the psychological stress. Depression is common among aging populations. Elderly also experience substance use disorder, and substances affect them more severely. They have less water in their body and therefore more alcohol effects, and their drinking results in higher blood alcohol content. At 90, peak blood alcohol content will be 50% higher than it would have been during their younger age. Other substance abuse issues among the elderly include nicotine use. Many of the elderly population have been lifelong smokers. Prescription drug abuse. One large study found that any person taking 8 or more medications, there was a 100% chance of drug interaction, and those prescribed medications also interact with alcohol, nicotine, and other drug use. Also among the elderly, we have to be concerned about abuse of over-the-counter drugs. Elderly drug use is a problem. There are alcohol and drug interactions. Past 50, 2 to 3 drinks per day is hazardous and may increase blood pressure. Alcohol increases the risk of falls in seniors. Past 50, most people entering treatment are there for the first time, and so this is a new experience for them. There are more problems with substance use for seniors. Illicit drug use. Seniors are staying with their drug of choice. This is a relatively new phenomenon with the hippies from the 1960s, and since then, as people age, many of them are continuing to use their drug of choice into the retirement centers and the nursing homes. There's also a question as to how much of the cognitive decline we've accepted among seniors is actually the result of either alcoholic dementia or addiction to other substances. When working with seniors, it's important not to think that all of their problems are simply the result of aging or of substance abuse. This is one reason that groups can be especially helpful to seniors. It gives them the opportunity to tell their story, a form of life review. It can reduce isolation, enhance communication skills, and address denial about the problems they're having, both with substances and with life. And it helps seniors to reconnect with the world. If you work with senior citizens, seriously consider forming groups specific to this age group. What's ahead on the Counselor Soapbox video channel? More videos on drug counseling, drug education, mental health, and wellness. If you've enjoyed this video, please click the like button below. Comments are always appreciated. And if you want to see new videos in this series, please subscribe. Thanks for watching. For more information, please visit my blog, counselorsoapbox.com. David Joel Miller fiction and nonfiction books are available on Amazon.